All right, we'll get cranked up. Welcome everybody, and we'll get straight to the business of the health insurance for calendar year 2022. Who's doing this?
All right, good evening. Paul Sidor from Independent Benefit Advisors is going to be here to discuss the 2022 insurance renewal. And I'm going to just turn it directly over to him. And I'll be available for any questions afterwards also.
Good evening. Let's get the easiest stuff out of the way. Delta Dental issued a 2.1% renewal increase effective January 1st, 2022. On behalf of the town, IBA negotiated a rate hold. That saved the town $633, and the employees who cover dependents, that saved them $242 annually. Superior Vision's rates are guaranteed for 4 years through December 31st, 2024, so there are no changes to rates effective January 1st, 2022. Hartford's life and disability insurance the rates are guaranteed for 2 years through December 31st, 2022, so there are no changes to rates effective January 1st, 2022. Now on to the main item. For the health insurance renewal, United Healthcare issued a 24.5% renewal rate increase effective January 1st, 2022. The annual dollar amounts that would result from the renewal increase are $98,000 to the town and $13,350 to the employees who pay for dependent coverage. Based on the claims experience, a renewal increase is warranted. However, based on analysis, United Healthcare's 24.5% renewal increase is excessive. Naturally, United Healthcare was unwilling to negotiate the renewal without competing bids from other insurers. Naturally, we sought bids from other insurers. We saw competitive proposals from insurance companies with benefits and provider networks that are comparable to the United Healthcare plan that's currently in place. Aetna's proposed benefits and rates were not competitive. For example, Aetna's lowest proposed individual deductible was $2,500, whereas the town currently has a $500 individual deductible. Just wasn't a good fit. Blue Cross's proposal is competitive. The annual dollar amounts that result from the Blue Cross 10.3% rate increase are $41,000 to the town and $5,575 to the employees that pay for dependent coverage. Additionally, Blue Cross is providing the town a one-time $40,000 wellness grant for the town to fund current and future wellness initiatives. The wellness grant is a gesture of goodwill. It is also an investment. Blue Cross hopes that the town's spending of the wellness grant to improve overall employee health can only help the insurance in the long run. Please refer to the side-by-side benefit comparison handout. It shows that the proposed Blue Cross benefits do not exactly line up with the current United Healthcare benefits. The Blue Cross benefits are better in some ways, and as indicated in green highlights on the handout, and they're worse in others, as indicated by yellow highlights. Overall, the value of the Blue Cross benefits is comparable to the United Healthcare benefits, and I'll explain that in a bit. I want to point out that there is an error on the handout that you have received. It is on toward the bottom of the chart under the therapy section. For physical, occupational, speech, and chiropractic therapies, the Blue Cross copay is $50, not $25, and that block should be shaded in yellow. The most important protection provided by the health plan is the out-of-pocket limit. This is the most that you pay for out-of-pocket deductible, co-insurance, and co-pays when you have a catastrophically expensive medical episode. The out-of-pocket limits are expressed in individual and family amounts. Each individual in the family has an individual out-of-pocket limit, and as an extra protection, a family will never pay more than the family out-of-pocket limit for the combined out-of-pocket costs for all family members. The Blue Cross proposal matches exactly the United Healthcare out-of-pocket limit, but other benefits do not match exactly. For example, the Blue Cross deductibles are higher. The Blue Cross individual deductible is $1,000 compared to the United Healthcare deductible of $500. At first glance, this would seem to be a big difference. However, the Blue Cross does not charge an extra $500 copay in addition to the deductible when using hospital providers for outpatient surgery, scopic procedures, and diagnostic imaging. United Healthcare does charge an extra $500 for these procedures, which adds significantly to your out-of-pocket cost with United Healthcare. I point out these two major benefit categories to illustrate how benefits can match exactly in one area, and even when there are benefit differences, the impact overall can be comparable. Are there any questions about any of the other benefit details on the side-by-side comparison that you would like to cover now?
Question?
Okay. And just a note, the proposed Blue Cross Healthcare Provider Network is the largest offered by Blue Cross. It includes most all doctors and hospitals in North Carolina and thousands of doctors and hospitals in other states' Blue Cross networks across the country. NC General Statute 584125 requires health insurers to provide employers with only 45-day advance notice of premium and benefit changes. On August 12th, we requested that United Healthcare provide an early renewal by September 7th. We repeated the request. However, United Healthcare did not provide the renewal until October 21st. As is typical of health insurers, United Healthcare waited to collect more claims data before issuing the renewal because it helps the insurer better forecast future costs. The time that United Healthcare waited to accumulate more health claims data reduced the town's time to seek proposals. It's just the way the game works. Competing insurers will not provide proposals until they review the current carrier's renewal. IBA prepared in advance all the requirements for the request for proposal. However, we had to wait on the United Healthcare renewal to submit the requests for proposals to the insurers. Insurers take 7 to 10 days to underwrite proposals. IBA conducted negotiations on the proposals as fast as possible. Significant preparation is required to successfully transition the employee health insurance to a new insurer. Contracts need to be prepared and signed. Employee communication needs to be developed and delivered. And a federal mandate requiring an open enrollment period for employees to weigh options and make enrollment changes has to be conducted. Blue Cross requires contracts, payment, and employee enrollment data by December 3rd to guarantee insurance ID cards arrive to employees by January 3rd. Missing the December 3rd deadline may result in ID cards arriving late, which causes concerns for employees with health care services and prescription drug refills in early January. Time constraints in the renewal timeline and in the insurance transition necessitates moving quickly. And that's why we're here today. Are there any
I have
questions?
one question.
Yes, please.
December 3rd deadline, I understand that. They want to know that we are committed by that date, but the employee enrollment data, is that just a list of the employees, or is that completed forms by the employees?
Coincidentally, this year, we implemented for the town an online enrollment system that will produce digitally all the employee data, their names, birth dates, covered dependents, and everything. So Blue Cross needs not only the contracting and the payment, but also that a spreadsheet of all that enrollment data by December 3rd.
So you're sitting on go, you're ready? That's all I was asking.
Okay.
Yeah. Okay, good, thank you.
Thank you. Yeah.
Were you contacted to reach back out to Blue Cross Blue Shield to try to renegotiate the deductible as well as some of the co-pays?
Oh, the deductible. We are limited, as a North Carolina municipal government, I forget the number of the statute, but there's a statute that limits the abortion coverage on the health plan to being no greater than the abortion coverage on the North Carolina state health plan.
The what?
Yeah, it's this very specific item of coverage. So the town of Zebulon, as a municipal government in North Carolina, cannot have abortion health insurance benefits greater than the abortion health insurance benefits in the North Carolina state plan. And the only reason I mention this is Blue Cross makes special benefit packages for municipal governments in North Carolina, but they don't make their whole array of benefit packages with this special provision that is compliant. So we have a limited selection. So we got, of the available benefit packages for municipal governments, the one that came the closest to the current United Healthcare benefits. It's not like a buffet where we can pick and choose different pieces. It's like a package, and we have to find the one with the pieces that most closely overall match our current benefits with United Healthcare. And so that's the one that's presented this evening.
Okay, I'm sorry. I was told that you could go back and renegotiate some of these items, so my apologies.
Oh, I'm sorry if there was any...
No, it wasn't you that made that. It was the town manager, so I just misunderstood. I thought that you could go back and try and renegotiate some of these once you had spoken.
Okay, like we could choose other benefits, you know, that is certainly possible. However, anything we choose will be further removed from the current benefits. In other words, the one we're presenting is the one that's the closest we could get to our current United Healthcare benefits. We did, at the request of the town manager, go back to Blue Cross and ask if we could have any further concessions on cost, and they confirmed that they have given us their best offer. In fact, we negotiated that $40,000 wellness grant after their initial proposal. We went back and negotiated for the town for that grant to further enhance the proposal from Blue Cross for the town.
Okay, thank you.
Thank you. Are there any other questions? Okay. Well, I thank you.
Thank you, sir. Appreciate it. One more time, any other questions before a motion? If you're ready, is there a motion?
I move that we approve the proposal from Blue Cross and Blue Shield of North Carolina to provide medical insurance for the town of Zebulon, and that we continue with Delta Dental, Superior Vision, and Hartford for calendar year 2022.
Second.
Motion made, second. Other comments or discussion? All in favor, raise your hand. And the motion carries. All right, well, thank you, folks. That was not the shortest one we ever had, but it's close. So, is there a motion to adjourn?
So moved.
Second.
We're adjourned.